On January 12th, Haiti was struck by a major earthquake and its devastating consequences. The loss of 200,000 lives and as many wounded. MSF, already running several projects on the island, was able to respond immediately, providing emergency medical care to victims of the disaster. Within hours, hundreds of wounded had arrived at MSF health facilities in search of help. Working conditions were difficult. Many members of staff were missing, and several of the buildings where MSF had been working were damaged. Despite the shock and turmoil, MSF's Haitian staff turned up to the health centres determined to help.
The first tremors were very strong. Afterwards, when I stepped out of the house, I was told that the MSF hospital had collapsed. And what I saw when I got there was catastrophic. The people in front of the hospital were either dead or wounded.
In the first 2 days after the earthquake, MSF staff already present managed to treat nearly 1,000 injured. Initially, all efforts were focused on emergency care, with priority given to the most serious casualties. Additional staff arrived quickly, but with thousands of injured in need of urgent treatment, MSF teams were overwhelmed. Marie-Lucie was at home on the 3rd floor when the building collapsed.
My arm is broken, and I have other injuries too. We have nothing, not even a place to sleep, so we just stay here.
MSF sent out mobile clinics and quickly set about finding new facilities where it could run further activities. Assessments were carried out in Jacmel, Léogâne and in several neighbourhoods in Port-au-Prince. By this stage, surgical teams were working in 7 hospitals: Saint-Louis, Cité-Soleil, Chancerelle, the General Hospital and Carrefour in Port-au-Prince, and Léogâne and Jacmel further west. In total, MSF now has a hospitalisation capacity of 900 beds. Other medical facilities are focusing on providing primary and secondary health care.
Over the last few days, we've seen roughly on average around 500 people have been coming through the door a day. We've got some really severe wounds, lots of fractured limbs, both arms, legs, many different kind of crush injuries.
A few days after the earthquake, a team of MSF psychologists also arrived in Haiti. They are there to help the people cope with the traumatic events and the fear of further tremors. The needs of the Haitian people have gradually begun to change. A month after the earthquake, more than 13,000 people have received medical treatment from MSF, including surgical teams performing 1,400 operations. Thousands of patients require extensive post-operative care, including dressing and physiotherapy.
For example, this lady, our first patient today, had a skin graft 8 days ago. We need to change her dressing, but it's very painful. So to avoid unnecessary pain, we'll do it under anesthetic.
At Isaïe Janty Hospital, MSF is providing gynecology and obstetrics care. The organisation has also set up a trauma and post-operative care unit.
So here we treat patients who have been operated in other MSF facilities, patients who've had major orthopedic surgery. So we're providing all the follow-up care. We operate on open fractures too and use external fixators for traction.
In addition to earthquake injuries, medical staff are seeing patients with pre-existing medical conditions like AIDS or diabetes whose health have deteriorated because of the situation.
Of course, we also have patients who, for example, are diabetic and need regular treatment. They need to find a doctor or a nurse because the clinics where they used to be treated are gone.
But needs go beyond medical care. MSF teams have been working on water supply and hygiene facilities, as well as organising the distribution of essential non-food items to Haitian families.
Hygiene conditions were very bad. There were lots of people living in a small area, and they didn't have access to latrines. So we wanted to set up a project to tackle that. And then there were people living, and some are still living, under sheets, having lost everything they had in the earthquake. So we wanted to respond to those two aspects very quickly: latrines to provide minimal hygiene conditions and shelter.
By the beginning of February, more than 1,500 national and international staff members were on the ground striving to help the people of Haiti. After the initial emergency phase, they are now helping the population to overcome the trauma and heal their wounds.